guys of New Mexico. In this video we will be reviewing how to care for contact lenses, including the wave contact lenses, the orthokeratology lenses, and the rigid gas permeable lenses. The first step while handling your contact lenses should always be to wash your hands with an antibacterial soap and water. Before cleaning your contact lenses, you want to make sure that you remove the contacts from your eyes using your hands or a designated plunger given to you at the office. The first product we will use will be the Labab Extra Strength Cleaner that looks like this. We will use 1 to 2 drops to clean our contact lens. We will begin with the right lens. If you're in an ORTHO-K lens, the contact should be red and it should look like this, and it should have a small dot. If you're in a wave contact lens, your right eye should be green, a slight hint of green, and if you're in a regular RGP lens, it will also be blue. Once you have the contact in your hand, you want to place 1 to 2 drops of the Labab Extra Strength Cleaner over the contact lens. After doing that, you will use your index finger and your middle finger to clean the contact. Now I will move my hand a little bit to the side so we can see the movement. You'll place your index and your middle finger over the contact, and you will move up and down and side to side to clean that contact lens. And this is cleaning the outside of your contact, and you want to do this for at least 30 seconds. When using the Labab, you want to make sure that you do not apply too much pressure on the contact lens because we want to avoid breakage. After the 1 minute, the contact lens should have some excess of that cleaner on there, and you want to use the Lacquer Pure saline solution to rinse it off before putting it in the peroxide cleaner. You will just use a couple of drops, and you'll probably have some of the saline left over from removing or inserting your contact lenses, and you can use that. You will next place it in the contact lens case that looks like this, and the little case has a designated spot for your right and then an L for the left contact lens. You want to make sure that we always store it in the correct slot for the contact. You will open up the case and you will place the contact lens face down, and you will close the case once you are done. We will repeat the same steps for the left eye, and we will go from there. After cleaning our left lens, which should be yellow if you are in the ORTHO-K lenses, it should be blue if you are in the wave lenses, and blue again if you are in the regular RGP lenses. Once we are done cleaning the lenses, we will use the peroxide solution, which looks like this. It's the refined one-step peroxide, and you will use that to fill up your contact lens case to where the line is on this marking here. You will fill it up completely to the top of that line, and we want to make sure that we get it right above the line so that we have enough peroxide to clean our contacts. Now you will store your contact lenses in this case for 6 hours, and you want to make sure that you do the full 6 because that will allow the peroxide solution to neutralize to regular saline solution. If you do insert your contact lenses before the 6 hours, it will burn your eye, so we ask that you are cautious and careful while handling the peroxide in less than 6 hours. If for any reason an emergency occurs where you have to put in your lenses before the 6 hours, we ask that you use the Lacquer Pure again to rinse your contact lens really well before inserting your contacts. This next step is especially important for ORTHO-K patients. Once a week, instead of cleaning the contact lens in your finger with the Labab solution, you will use a Q-tip like this and the Labab Extra Strength Cleaner once again. You will repeat the same steps, 1 to 2 drops on the palm of your hand, but this time instead of your fingers, you will use the Q-tip to clean the inside of the contact, and you will flip it over to clean the outside of the contact. In order to help stabilize the contact lens, you might want to hold it in between your fingers, but you want to be very careful not to apply too much pressure while holding the contacts because you can break it. So again, you want to clean the outsides, and you want to flip it over to clean the inside, 30 seconds on each side. This will avoid the protein buildup of your eyes on the contacts and will maintain you with the sharpest vision and cleaner contacts. Again, the step should be done at least once a week. This concludes our video on how to clean and care for your contact lenses. Following these steps every day will allow your eyes to be healthy while using your contact lenses. Now remember, you want to wash your hand. You want to use all of these products that you can purchase here in our office. And once a week, we want to use our Q-tip to clean our contact lenses.